Hey everybody, Amitabh Metta Love here. This video is actually for a friend of mine. I'm gonna say it's for Vanessa, because it is. So it's also for anybody else who is having degenerative disc problems, who's having sciatica, any other lower back problems, a lot of pain in the back or anywhere in the back. My dad died a couple of years ago, and I saw what degenerative spinal degeneration can really do and how much suffering it can cause. Now, he died from, he had cancer as well, but I saw the last years of his life and how much suffering, how many drugs he had to be on just to stand up, just to be able to live with some sort of freedom from pain. So, no matter where you're at right now, I know this sounds bad, but it can get a lot worse. Now, there are some things that we can do to prevent that from happening. I'm doing it myself because I've been having sciatic pain for about 4 months, and I'm done with that. I'm done with going through this pain. The only way I can get out of it is by doing something with my body. Now, wherever you're at, there's going to be something you can do to strengthen your body. The most important thing is strengthening and stretching. The core has to be strong. If there's lower back problems, there's guaranteed a weak core. So I'm just going to show a few exercises here that you can do, and you have to do them within your means. So no matter where you're at, you just start and you do a little bit each day and you build up. So I'm going to start first showing you a plank. I'll show you a couple of different variations on this. So the full plank, of course, is like this. And you want to hold it until you feel a nice burn. Hold it as long as possible. Now, if you're having really bad back problems and you're really weak, you might just have to be like this, or even like this for now, on your knees. So that's okay. Of course, your head's not going to be looking to the side. But most importantly, let me just tuck my shirt in. Is to get this core working. So you could be on your elbows like this, or you could be on your knees. Even that, if you hold that for a few minutes, you're going to feel that in your core. So the plank is probably the best one for rebuilding your core strength. Now, once you get more advanced, once you start gaining some strength, you can do these things. You raise one leg, raise the other leg. Hold it for 30 seconds. You can even do bird dogs. This will strengthen your core like you won't believe it. It's hard to do, but it's unbelievable. The other thing you can do is a modified cobra. So sometimes if you have lower back problems, cobra is going to be really painful. It's really hard for me right now. So you just do what you can. So just come up like this, down, and down. And don't really push yourself up. Like right now, that's where it starts to hurt for me, so that's as far as I'm going to go. I'm not going to push past into the pain. There's a certain point where if you're having pain, it can actually cause more damage, so you want to just push up just where you're just touching that point, but it's not even close to pushing into it. Okay? So you just a little bit, just raise your head even. Just even raising your head is going to put a tremendous amount of pressure on your lower back, and just even this causes your lower back. So if that's where you're at, just do that. I can feel that in my lower back big time. And then eventually you can do Supermans, like this. Ideally, you bring your legs up as well. So this is when you're feeling more strength. Hold it for 30 seconds, 20 seconds, 10 seconds, 5 seconds, and build up that strength in your core. You can also do some crunches. Of course, the standard crunches. Make sure you're not pulling on your neck. Make sure you're just supporting your head. You can also do it like this. Put your hands underneath your butt. Bring your legs up like this. Like I said, no matter where you're at, you're going to be able to do something, and you have to. Trust me, if you don't do something, big trouble. Because the one thing I learned about my dad, as I saw him dying over a number of years, is that the end of your life, or even most of your life, if you're not even close to the end of your life, you don't want it to be a life of pain and a life of drugs and having to cover up pain, because all those pain medications do is degenerate the spine, like NSAIDs or NSAIDs. So anti-inflammatory drugs, they degenerate the discs further. So gotta try to see if, it might seem impossible right now to get off them, but there is a way. There are supplements you can take like curcumin, turmeric. Look up turmeric and inflammation. It's a miracle. And try to do some of these exercises. Here's another one. So side plank. So you might not be able to do a full, side plank like this, but you might be able to go on your forearm with your knees bent like this, and just hold that. Maybe put your arm up. That's not that hard to do. And look up at the sky. Hold that. Eventually, you might be able to, come up by your legs. Do it on both sides. So these kind of things can save your life. They will save your life. Some type of core strengthening is just absolutely crucial and necessary. If you can't do any of those, what you can do is lie down and use static contraction isometrics of your abs. Just squeeze them. So throughout your day, whatever you're doing, if you're sitting, squeeze your abs. The other thing that's really important in lower back problems is the psoas. This muscle connects from your leg bone all the way up into your spine. So it's like goes on a diagonal, and it's a psoas muscle that you use to contract to raise your leg, actually. So this muscle gets really tight. So ideally stretching it is done like this, and you can. So you're going to stretch out this long muscle in here, and then you can raise up and then raise your arm and hold this for 30 seconds or a minute or 2 minutes, and then do the other side. Also, if you have lower back problems, I can guarantee you have tight hamstrings, almost guaranteed. Mine are so tight. Watch how tight my hamstrings are. It's ridiculous. So this is what I'm working on right now, because I have to do this every day. If I don't do this multiple times a day, it's a disaster. How many problems my tight hamstrings cause. That's as far as I can go right now. I know, does this seem pathetic? Well, it's not. It's just where I'm at. So that's okay. So this is where I go to, and I'm going to hold it for 30 seconds, a minute, 2 minutes, and most importantly, breathe. Breathe, breathe, breathe. Focus on your breath. Another thing I would recommend, if you're in chronic pain, I would recommend some sort of meditation practice. If you focus on one object, it could be a mantra, it could be a sound. So you could say Om, Om, or peace, peace, love, 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 love in your mind. Or you could focus on your breath, the feeling of your breath coming in and out of your nose, or the feeling of your belly rising and falling. So there's always some movement going on in the body, and if you keep your mind on one point, on one single object, and you keep bringing it back. I know it might seem difficult in the beginning. If you keep bringing it back again and again, what happens is the mind starts to develop some mindfulness strength. And then as it becomes more able to stay with one thing, everything else, all those hindrances, all those discursive thoughts start to drop away. And then an unbelievable peace will overcome you. And then your muscles and your body, all areas of your body and mind get a deep, deep rest that you cannot get any other way. It's impossible. And eventually you could get towards the jhanas, which is like the ultimate rest. And so why not rest in peace while you're in the body? You don't have to wait till you're dead to rest in peace. You can develop and cultivate this rest, this deep spiritual rest in your life right now. So it does take some time. You know, you do have to dedicate every day to meditate. But even 5 minutes, even 1 minute of just watching your breath or repeating a mantra is going to give you some relaxation. So the more you can do it, the better. The more you can do these exercises. You got to commit to doing these things every single day. If you don't, the body needs to be worked every single day. Now, remember when we were kids, we didn't have these problems, did we? When we were kids, we were running around, jumping around, playing 24/7. We didn't have back problems. It was a joke. You just felt amazing all the time. It's only when we get into these sedentary lifestyles, when we're sitting down for excessive hours, and the studies are showing conclusively, the more you sit, the more damaging it is to the body. So it's absolutely horrific for the body to sit. The body's not meant to sit for very long at all. The only time you would have sat in nature is you would have sat like this. We didn't have chairs, so you would have sat like this, eating your food or preparing or whatever. And that's how we would have sat. You know, I mean, occasionally I guess we would have sat on the ground like this, but we would have never sat in chairs. And so when you sit in a chair for long periods of time, you're sitting like this, and your hamstrings are getting tight. This muscle, this psoas is getting tight. Everything's getting tight. And then what happens is that psoas muscle connects to your spine. It starts pulling on your spine, and then it starts crunching things down. So, and that's when discs start to degenerate. So, another important thing, if you can do it, this is recommended by Dr. Bergman, who I highly recommend, is, of course, drinking a lot of water. If you don't drink a lot of water, you're not going to be able to hydrate your discs, and they're going to degenerate. The other thing that he recommends, I'll do it like this, but normally you could do it sitting down too, but you would do it standing up with your legs wider than your shoulders, and he says go like this, and twist. Now this might not be good for you to do if you're in a lot of pain. You might need to go really slow with it. Just slow like that. But eventually, you want to really rock it, because what happens is the discs can only become hydrated through imbibition, so through movement. They can only drink in those fluids. And nutrients, more importantly, even is nutrients. That's how they get their nutrients, through movement. So if we don't move, the discs cannot get nutrition that they vitally need. They have a low blood supply compared to the rest of the body, because we're supposed to move. We're supposed to be moving all the time. We're not supposed to be working 9 to 5, sitting. But this is the world we live in. So unless we can create another lifestyle for ourselves, we gotta find a lot of ways to move around. Make sure you're not sitting on the couch or lying on the couch or sitting in a chair for extended periods of time. If you sit for work, stand up every 20 minutes. Stand up, stretch. Stand up. Do something. Just stretch in some way. Because you gotta get moving. You gotta get that blood flow moving to the spine. I'll show you one more thing that's really been super helpful for me for my lower back. Is this. It's like a triangle, and just slowly going like this, back and forth, like a seesaw. So what this does is it's going to stretch out each side, your oblique muscles, and it's going to stretch out that side. But at the same time, on the way back, you have to stabilize yourself the entire time. And on the way back up, you're strengthening those muscles. So you're stretching and strengthening, which is ideal. So you do that, however many times you feel like you do it multiple times a day. I love you, Vanessa, and I love you, everybody else. I hope this has been helpful. I hate to see people in pain. I hate to be in pain myself. There is another way. We can always heal ourselves to some extent. I understand some things, once they're degenerate to a certain point, there's going to be some problems, but you can always get to a stronger state. And if your muscles are strong, supporting your spine, and if you're hydrated, so don't drink any alcoholic beverages. Drink tea, that's okay, but make sure you're drinking a lot of water on top of that. Hydrate your body, move it, do some of these exercises, and trust me, you will feel better, 100%. And if you combine it with the meditation, with the cultivating of the peace, you'll get that. It's called the relaxation response, and you'll start to feel really, really good. And at the very least, if you do end up living in a lot of pain, at least you'll be able to know how to manage it in your mind, which is super important. So I love you. Have a wonderful day, and we'll catch you later. Hopefully less pain.